Hey everybody, welcome back to The Imperfect Dietitian. Today I want to talk to you about a very important topic on medication. There is a very popular medication that's in just about every desk drawer, purse, glove box, medicine cabinet, or bedside dresser in America, and that's called an NSAID. An NSAID stands for non-steroidal anti-inflammatory drug. And these are things like ibuprofen, naproxen, and even aspirin. So what we have to understand is that these medications have been marketed to us and advertised to us and sold to us to make us believe that, hey, it's no big deal. Pop an NSAID, take an ibuprofen if you have a headache or some muscle soreness or a cramp or arthritis and things like that. They can be very helpful. As you know, you take these things, you feel better. But unfortunately, there's quite a bit of research that shows out there that there's a lot of baggage that I want you to be aware of. There's been some recent research that shows that regular use of an NSAID can increase your risk for heart attack, for stroke, GI bleeding and ulcers, can lead to things like IBS, even intestinal permeability. So that's leaky gut. And leaky gut has been shown to be one of the leading causes of autoimmune disease. Also, an NSAID can have an effect on your gut flora, and your gut flora is very important for your overall health and well-being as well. So regular use of this, what is that? Well, is it every day? Well, yes. Is it every week? But even every month. And so taking these things once a month for periods of time can actually increase your risk for these things that I just mentioned. So I really want you to think critically before you just randomly just grab one of these things and pop them into your mouth. But what I want you to think about is why these things are happening to you to begin with. So we're dealing with headaches and inflammation and some maladies that make us uncomfortable. We want to grab the NSAID, but we're always quick to treat the symptom but not look at the cause. And the main reason for a lot of these maladies that we experience, unfortunately, it's our own lifestyle. It's the food we eat, it's the things we drink, it's the lack of sleep, it's our stress, and even maybe a lack of exercise in certain cases. So, because exercise is very beneficial. I mean, yeah, you can over-exercise and you can get awfully sore and you end up taking an NSAID to reduce the inflammation. But, be careful before you start going down that path. Some alternatives for pain relief that are not classified as an NSAID, things that are more natural. So I'm sure most of us have heard of the wonderful anti-inflammatory properties of things like turmeric. And the active ingredient in turmeric is called curcumin. And there's a great product out there that I happen to like called Longvita. So that's a formulation that's been shown to be good for muscle aches, joint aches, and things like that. You might be mentioning or thinking to yourself, what about Tylenol? And Tylenol, or acetaminophen, is not an anti-inflammatory, so it doesn't fall in the NSAID class. It is great for fevers, it is great for relieving pain, but again, it's not an anti-inflammatory. But it does potentially pose some other risks, mostly associated with your liver. So taking that regularly down the road could lead to more problems associated with that. Whereas ibuprofen and these NSAID class of medications are kind of hard on your kidneys. So how do we treat inflammation? Well, look at your lifestyle. Look at the food you eat. Look at the sleep you're getting. Look at how much alcohol you're drinking, and take that into check. Take that into account before you start looking at other things. Looking at these alternatives that I mentioned to you, as far as like the turmeric, but also omega-3 fatty acids, cold water fatty fish, or fish oil. So by increasing our omega-3s, we can reduce inflammation. So that could be helpful as well. So I guess on the last note here is that one of the things we have to think about before we take an NSAID is also think clearly before we start giving these things to our children, because there is liquid NSAID available to kids as well. And we just seem to think that they're so harmless. Our child has a fever, they have a little ache and pain. Yes, they're very effective at reducing pain and fever, but are they always necessary? Just think first. Fevers are our body's natural way of fighting off an illness. So sometimes a fever is a good thing, but they can get dangerously high. So understanding that maybe if it gets over 102 or something like that, we might want to take something to reduce our fever. But keep in mind that acetaminophen or Tylenol is effective in doing that as well. But so this is just kind of words of advice and encouragement to think twice. I don't think most of us know that there's that much research out there against NSAIDs. I just wanted to make you aware. So thanks for watching, and please leave a comment and subscribe if you like this, and I look forward to seeing you again next time. Take care. Bye-bye.